Muscle technique for the iliopsoas. If you have a portable examination bench that you regularly use, then place the foot on the bench's far side so that the bench does not simply collapse shut, because the patient must sit quite right at the very edge to complete the maneuver, and consequently the bench can sometimes become a little too light, such that it nearly collapses on its own, which of course would be highly undesirable. I place my foot on the side of the leg here on the examination table. The patient sits completely down, right at the edge, so that the crease of his gluteus maximus is at the very edge. The farther out it sits, the better. Consequently, he grasps with his healthy leg, and in this case the left one, and then uses it as a deliberate resistance and lies down. If the patient is very weak indeed, you can of course help them down safely and gently. Thereafter, I place my own rib curvature here against the leg with careful, steady pressure, and you can clearly see that the opposite iliopsoas lifts up. This is what is referred to as the so-called barrier, and within that barrier I firmly hold the thigh with a forked grip like this, and I ask the patient, against my own resistance, to lift the leg up toward my hands. So he performs a flexion and firmly holds this tension for a duration longer than 7 seconds. After that, he breathes in quite deeply, and as he exhales and gradually relaxes, I let the leg follow downward, and that is the patient's own, what you might call, natural relaxation, which determines how far the leg can be lowered. Do not press the leg down. Instead, simply allow it to follow downward, measuring how far it relaxes, and then you repeat the same motion again, one more time. So lift your leg against the barrier's resistance. 6-7. Take a slow, deep breath in, and then breathe out slowly and evenly, letting every muscle loosen and relax completely. Then the bandage is gently drawn downward along the limb. You should perform this 3 to 5 times on the affected side, or on both sides if both legs are affected.